Hi everyone, welcome to PharmaGrid. So today we will continue with the remaining question discussion series. Question number 61. Particle size and crystal structure are generally important factors in bioavailability from oral dosage forms when? The options are when the drug is relatively insoluble in water, which means less than 1%, the molecular weight of the drug is high, which means exceeds 1000. Next option is the drug is administered as a solution. The characteristics of the drug are such that it is not absorbed from the gastrointestinal tract. And last option is it is a racemic mixture of isomers. So here the correct answer is option A, that is the particle size and crystal structure are generally important factors in bioavailability from oral dosage forms when the drug is relatively insoluble in water. Insoluble means the solubility is less than 1%. Next question. The elimination half-life of penicillin G is approximately 0.5 hours. Thus, when administered intravenously every 6 hours, what will happen? So here the options are half the administered dose will be eliminated in the urine at 1 hour. Little accumulation of penicillin in the body will occur after repeated administration. Each dose will only act for half an hour. It will take an hour for each dose to be eliminated, and the last option is all of the administered dose will be metabolized 1 hour after taking the dose. So what do you mean by half-life? Half-life means it is a time taken for a drug to reduce into its half of its initial concentration. Here the penicillin G follows first order kinetics, and the features of first order reaction or first order kinetics include here the rate of elimination is directly proportional to plasma drug concentration, and the clearance is a constant, and always a constant fraction of drug is eliminated per unit time, and these drugs are comparatively safer drugs. Okay, so here correct answer is option B. Okay, remaining all other options are wrong regarding this penicillin G. So the correct answer is option B. That means little accumulation of penicillin in the body will occur after repeated administration. The route of drug administration that will give the most rapid onset of the pharmacologic effect is, the options are intramuscular injection, sublingual administration, subcutaneous injection, oral administration, rectal administration. So in the question they have asked us about the drug administration or the route of drug administration will give us the most rapid onset of pharmacologic effect. Here the correct answer is option B, that is sublingual administration. Next question. If a drug has a very small volume of distribution, it is likely that this drug, the options are does not accumulate in various tissues and organs, has a short biological half-life, is not bioavailable, will not be effective, is widely distributed in the body. Here the correct answer is option A, that is if a drug has got a very small volume of distribution, which means that the drug is more concentrated in the plasma. That means it does not accumulate in various tissues and organs. Next one, drugs that demonstrate nonlinear pharmacokinetics show which of the following properties. The options are a constant ratio of drug metabolites is formed as the administered dose increases. The elimination half-life increases as the administered dose is increased. The area under the curve increases in direct proportion to an increase in the administered dose. Both low and high doses follow first-order elimination kinetics. The steady-state drug concentration increases in direct proportion to the dosing rate. So here the correct answer is option B, that is in nonlinear pharmacokinetics, the elimination half-life increases as the administered dose is increased. Question number 66. When making pharmacokinetic recommendations in aminoglycoside dosing, if you want to decrease only the trough concentration, you would. The options are decrease the dose, take the trough measurement 3 hours before the next dose, lengthen the dosing interval, increase the dose, none of the above. Here the correct answer is option C, that is lengthen the dosing interval. So trough concentrations means the trough concentrations are indicative of drug accumulation or drug toxicity. So to decrease only the trough level and maintain the peak concentrations, lengthening the dosing interval is the appropriate method of choice. To calculate a loading dose, one must first determine the options are T half, body clearance, fraction protein bound, volume of distribution, all of the above. Here correct answer is option D, that is volume of distribution. The optimal loading dose is easily estimated by using the following formula, that is loading dose is equal to desired plasma concentration into volume of distribution. Radioactive decay follows a. The options are mixed order rate, fractional order rate, zero order rate, first order rate, second order rate. Here the correct answer is option D, that is radioactive decay is a classic type of first order reaction. To achieve the same steady state plasma concentration for a drug that is excreted by the kidney in renal failure patients as in patients with a normal renal function, you should. The options are increase the dosing interval, decrease the dose, adjust both the dose and the dosing interval, do any of the above depending on the pharmacodynamic properties of the drug, not adjust the dosing regimen unless the patient shows signs of toxicity. Here the correct answer is option D, that is do any of the above. Any of the above means either we can increase the dosing interval or decrease the dose or adjust both the dose and the dosing interval depending upon the pharmacodynamic properties of the drug. Both adjustment of dosage interval and dosage size reduction are acceptable methods for decreasing drug accumulation in patients with renal failure. The two methods may be used in combination depending on the dosage forms available, the therapeutic range and convenience. Question number 70. Which of the following factors may make it necessary to give lower doses of drugs to geriatric patients? The options are reduced enzyme activity, reduced kidney function, enhanced absorption, A and B only, A, B and C. Here the correct answer is option D, that is A and B only, which means reduced enzyme activity and reduced kidney function. The liver and kidneys commonly become less functional in the elderly or the geriatric patients. So with this question we have completed today's recalls or today's question discussion series. So everyone, please like, share and support. Thank you everyone. Thank you for watching this video. Have a great day.